Good morning, everyone, and welcome to yet another edition of CBS 42 Now. I'm Phil Penarski. We are just a few moments away from hearing from UAB as they discuss the latest variant of COVID-19, Omicron, and its effect on the world as well as the pandemic itself. We will be hearing from Dr. Jeannie Marazzo with UAB in just a matter of moments. It appears that she has approached the Zoom call, so we will send you there live now to hear her remarks on the new variant of COVID-19, Omicron.
Has enough mutational change in the virus's genetic makeup to affect its ability to do several different things. The WHO description of a variant of concern means that it changes the virus's ability to infect, to cause severe disease, or to avoid some of the measures that we take as a population to not be affected by it. So things like vaccination, mask wearing, social distancing. The WHO has only designated 5 variants of concern in this whole pandemic. And so Omicron is number 5. Why are they concerned about it, and where did it come from? We know it's there because several laboratories throughout the world have been doing routine, what we call molecular surveillance. Basically, they get viruses from people who are infected in the community, and they do the genetic sequencing to see what types of SARS-CoV-2 they are. Until recently, it's been, as I think you know, overwhelmingly the Delta variant. And we've taken a very hard hit from the Delta variant, particularly here in the US and especially in Alabama. I think you all remember last summer pretty well. The only good thing about the Delta variant is that the vaccines have been effective against it, particularly if you get a booster shot or a third shot after 2 of the mRNA vaccines. The challenge with the Omicron variant is that the sequences that we are seeing have told us that it has probably around 50 mutations that haven't been seen in combination before. And when you look at where these mutations affect the makeup of the virus, they're heavily concentrated in the spike protein. And as we've talked about before, that spike protein is the thing that sticks out of the coronavirus and attaches to the lining of your throat, your nose, your lungs. And it's also the thing to which antibodies are really, really targeted, right? If you can bind on that spike protein, you can take away its ability from sticking essentially to your body, your vulnerable body tissues. So the concern with the variant is that there could be enough mutations to affect not only its ability to bind, which would make it potentially more infectious, but also the ability of antibodies that are produced from the current vaccine or even previous infection with Delta, for example, that might reduce the vaccine's efficacy. We know about it because the molecular surveillance in South Africa, particularly in KwaZulu-Natal, which is where this laboratory is actually excellent. And these scientists were incredibly responsible in reporting this. We now, unfortunately, know that it's already spread to 4 continents and numerous countries. So as with everything else, we're always kind of playing catch up with the spread of this virus. So it really remains to be seen how extensively it has spread. One concern that's been raised is that South Africa has had an increase in infections, just the number of COVID infections in the last few weeks. And so some people are concerned that Omicron might be behind that. We don't know that that's the case. It is a reasonable assumption, but we should know more soon. One small silver lining about that observation is that they have not seen an increase in hospitalizations and deaths in association with that increase in cases in South Africa. So maybe that means, and again, this is all conjecture at this point, maybe that means that it's not going to hit us as hard as the early stages of Delta did. So lots to learn. In the next week or so, we should learn more from laboratory work about whether the antibodies that people get when they get vaccinated will protect them against infection from this new variant. So very eager, obviously, to hear about that. In the meantime, all we can say is to be cautious, continue to get vaccinated. If you haven't been, get your booster shot if you haven't had it. And for now, wear a mask if you're going to be in a place where you're concerned about getting infected. So I'll stop there. Probably a lot of questions that people have.
Sure. Thank you. The first question comes from Ian Wright with WVTM. He asks, and you may have touched on this a little bit, but what do we know about protection from the vaccine against this variant? And or maybe you can also address when we might find out information about that.
Sure, that's a great question, and that's what's on everybody's mind, right? Because vaccination clearly has made an impact in so many places. And in fact, one of the reasons people think that South Africa was a site of emergence is that it has not had access to vaccines the way that we have in the United States. In fact, less than probably 20% of people are vaccinated in South Africa. So there's kind of two ways that we will know if the current vaccines protect against Omicron. One is studies in the laboratory where they will take antibodies that have been generated in people in response to the vaccine and literally work with the virus, the Omicron variant in the lab to see if those antibodies stop the virus in its tracks. If that happens, that's very, very reassuring. And in fact, that may mean that we just need to keep doing what we're doing and to do it stronger and better. The next level of reassurance, of course, will be to see what happens in communities if this variant spreads. So are we going to start to see breakthrough infections? In fact, what about people who've already gotten boosted with the current vaccines? We hope it doesn't happen. Hopefully it won't get that far. And especially if these initial laboratory testing efforts show that it should work, we could be okay. I think the laboratory results should be out probably in 8 to 10 days. That's what the Moderna folks said this morning. So I would say by the end of this week, at earliest, we should know more.
All right, thank you. Ashley Carter with WAAY in Huntsville is asking, how confident are we with the booster protection against this variant, kind of building off of that last question?
Yeah, Ashley, that's a great question. So remember when you get a booster, you are not just, I always talk about it like filling up the tank or topping up the tank, right? You are probably not just increasing the level of the antibodies you have against the virus. You may even be increasing the breadth or the type of antibodies you have against the virus. Not totally clear yet, but that's probably the case. If that's the case, I would say that having had 3 shots is probably going to be better against Omicron, even if it is a little bit resistant to these vaccines, compared to having had only 2 shots, and certainly compared to only having 1 shot. So I think even if the Omicron is evading some of the current vaccines, it's still going to be advantageous to have had that booster shot, because you're going to have more antibody and you're going to have more different types of antibodies. So again, we'll find out, I think, soon, but I don't think there's any reason to say that you should be better off if you have had a booster shot, no matter what's coming down the pike in terms of these variants.
All right, thank you. Kanisha with WZDX is asking, I guess, a technical question about how these variants are named. Can you maybe explain that process for us?
Sure, I can try, Kanisha. It's actually it's an interesting question. So what they have done, you may remember in the beginning, they were naming variants by the places that they were found. So there was the South African variant, there was this other, the New Zealand variant, or a few other countries. I don't think there was a New Zealand variant. We've tried to get away from that just because there can be a lot of stigma and misinformation associated with just talking about that point of origin. So WHO started to give them Greek letters. So we had alpha, beta, delta, gamma. We've had mu. The next one was going to be new, NU, and WHO reportedly decided that that was too confusing to call it the new variant because they're all new variants, NEW. And then the next one would have been a letter, a Greek letter, that's a very common surname globally. So they skipped right to Omicron. So that's how they got to it.
Great Greek alphabet lesson. Thank you. Next question is from Brian Lyman. It says, given that there's still a lot to learn about this new variant, do you see any steps public health officials can or should take against the virus? It seems difficult to plan for something with so many unknowns.
Yes, welcome to our world. Absolutely, that's an incredibly insightful question. So in some ways, right, people have already reacted. Public health authorities and governments have already reacted. So travel bans are increasing, some borders are even closing. And I think the question to ask about that is it prudent or is it over cautious and reactive? You know, we won't know probably for another week or two, honestly, you know, and if it looks like this variant is as bad as it theoretically could be, everyone will be really grateful that these measures were taken. If it doesn't, people will, you know, again, be sorry and sort of think that we overreacted. I think the most important thing that we can do, and everybody I think can agree on this, is to vaccinate as much as we can, not just in people who can get a booster shot, but really increase the rate of vaccination globally. Again, when you have places where vaccination coverage is so low, they are fantastic setups for exactly this type of mutation to happen. And that's what we've been saying all along. This is not magic. You know, we've been talking about how places with low vaccine coverage are going to be the most vulnerable to the emergence of these new variants. So I think that's really important. And for now, you know, I would wear a good mask, particularly if you're out in public, and especially if you're in unventilated or poorly ventilated area. We haven't really talked about ventilation for a long time. If you're outside, it's probably fine. We haven't seen massive outbreaks associated, for example, with football games, thank goodness. But, you know, if you're inside, use caution, and especially if you are immunocompromised or if you are around people who are immunocompromised or who are not vaccinated or who might not have the best response to the vaccine.
All right, thank you. Next question is from Chastity Maxey with WBRC. Chastity, go ahead.
Thank you, Adam, and thank you, Dr. Marazzo. I actually have a couple of different questions. The first one is, since we're not really sure yet whether or not the current vaccines are really going to be super effective against the Omicron, will this mean that another vaccine could potentially need to be developed? And if so, will that mean that we will then all need to be revaccinated? How will that work?
Yeah, that's a great question, Chastity, and your timing is excellent as well. So yes, if it turns out that the current vaccines won't do the trick, the vaccine manufacturers will very likely need to create a whole new vaccine. And this is very much kind of what we had talked about, whether this was going to become a seasonal event and every year we were going to have to get a new vaccine. Remember, January last year is around the time that we got increasing availability to the vaccine. The most vulnerable people were able to be vaccinated. It's possible that next month, by January, we may have another vaccine. I know that Moderna executives, which is one of the mRNA vaccines, of course, along with Pfizer, talked this morning about the fact that they were already pursuing the path to start developing a vaccine based on the mutations that we're seeing in the Omicron variant. Again, you might say, is that overreacting? I don't think so, because no matter what happens, you're going to want to have the option to move forward if this turns out to be bad. How soon would we have that? Probably sometime early in 2022.
Okay, and then my follow-up question to that is, you know, we're already having problems with people getting their initial vaccine. And so when they're hearing now that, hey, that vaccine doesn't even work anyway. See, more reason for me not to get it. So what would the message be to the people who are still straddling the fence now? And, now we've got this new variant. What is going to be the tipping scale, do you think?
I think that the best advice that I could give people who are still not vaccinated would be to remind them that we still don't know where this virus is going to take us. And we do know that the current vaccines have been extraordinarily effective at preventing death, hospitalization, and severe illness, right? So, when you put those things together, and then you have the specter of a potentially new variant that might be more infectious, that might be more serious, we don't know. You really want to have yourself in as good a place to take that new variant on as possible, right? The older vaccines, and it's funny to call them old, they're barely a year old, but the first generation vaccines, the Pfizer and the Moderna, really do a fantastic job of gearing up the antibodies in your body to prevent COVID or severe COVID and hospitalization. It would be much better to be in that place even if you are exposed to Omicron and it had some ways to get around those antibodies. Again, time will tell if that's absolutely true and if I'm correct. But I think most people who study immunity would say much better to have a baseline set of antibodies that, whether it came from getting naturally infected or whether it came from getting immunized, before you encounter something that could be even worse. So in other words, you don't want to be totally vulnerable and never have had antibodies to COVID when you meet this new variant.
All right, thank you. The next question is a two-parter on testing. Is there a way to test for this specific variant when using a PCR test to detect if it's in Alabama? And related to that, is this strain more difficult to test for?
Yeah, that's a great question. So the PCR test that we are using or that's available sort of commercially will not tell you whether you've got Omicron or not. You've got to actually sequence it in the lab. We're very fortunate here at UAB, working closely with our state and county health departments to sequence as many viruses as we can, both from the community and from people who are hospitalized. So my prediction is that if it's going to show up here, we will be among the first to detect it, at least in our sort of southeastern, deep south region, and certainly in Alabama. So that's good. In South Africa, it's interesting. There are rapid rapid tests that can look for COVID, and there are some tests that can distinguish whether or not you've got Omicron or not. It's unclear whether that's going to turn out to be really useful, and the reason for that is a little bit too complicated to go into. But there may be ways to do more rapid molecular surveillance in the coming weeks, and I think it'll be important to see that. But for now, the message is that that every test that we're using routinely here should be able to detect any of these new variants or any of the old variants, and that we, along with many other groups, will be doing real-time molecular surveillance to monitor for its emergence here and elsewhere.
All right, thank you. The next question is from Hannah Ritchie. Let's see. According to the WHO, the initial reported infections for this variant were among university students in South Africa. Has this been the same in the U.S. and or Alabama if they've been detected?
Right. So we haven't detected them here yet. There have been no U.S. cases. There have been no Alabama cases. Again, I think most people would say it's probably a matter of time. And it's so early that we really don't have much information on the epidemiology of the cases that have been detected, for example, in Italy, Australia, and some of the other countries, Scotland, that we've heard about. We do know that for most of those, there were links to travel to South Africa. So it does appear to be that the virus is taking advantage of travel to get introduced to these other areas.
Thank you. Next question is from Mary Scott Hodgen with WBHM. At this point in the pandemic and facing another possible increase in transmission, how are hospitals, healthcare providers doing in terms of staffing shortages and potentially burnout?
It's a fantastic question. I think that was probably the first thing that came to my mind when I heard about this. It was sort of just like, oh no, just when you thought it was safe to go back in the water, kind of thing. People are still struggling mightily with adequate supply chains, adequate staffing, from nursing all the way to the people who deliver food in hospitals, to people who provide respiratory therapy support. And this is not just at UAB, it's pretty much everywhere. So the concern, of course, is that this is going to further drive people away from taking care of patients and from working in these settings. I really hope that's not the case. Again, you know, this is going to take all of us to continue to be really committed, really dedicated, and to show up. I certainly understand people being burnt out. It's been exhausting and relentless. But you know, we've gotten through it together to this point, and my hope would be that we will continue to do that when we see this new variant, which we probably will.
All right. Next question says the variant's emergence coincides with holidays, which last year preceded a spike in cases and hospitalizations. Are there steps you would like to see maybe schools or other groups taking now while new cases are still fairly low?
That's absolutely right. The timing could not be worse, right? It's cold in most of the United States, or in much of the United States. People are returning to their communities, their families for the vacation, the holidays. So it really is a great opportunity for the virus to take advantage of us once again. That's exactly what happened last year. I would say the steps that people, organizations, schools, anybody can take are pretty much what we've been talking about all along. It's really boring. People are tired of hearing about it. But if you want to celebrate safely with people, you don't want to wear a mask in your house, make sure everybody is as vaccinated as they can be and should be, including boosters. And if you are going to be traveling and you're going to be mingling in spaces, particularly with poor ventilation, go ahead and make sure you have a good mask. I think that's really, really important. Don't forget to wash your hands. Remember, we haven't been talking about hand washing very much, but remember, you touch your nose and then you touch something else, you touch somebody else's hand. That's really a great way for the virus to get transmitted. So it's pretty basic. The one thing I would say we're talking about this holiday that we weren't last year was widespread availability of vaccine. And of course, vaccines being available for kids. That's huge, especially given that kids don't really want to or can't wear masks much of the time.
All right. Next question is from Brian Lawson. He asks, is it reasonable to assume this variant is already in the U.S. and maybe even Alabama?
So, Brian, one of the things that I hate the most about this pandemic is when people ask me to make predictions. So I almost never make predictions just because we've been confounded and we've been burnt so often by this crazy virus. I will go out on a limb for you, though, just to answer honestly. I think it's probably here. You know, how many flights from South Africa have come to the United States in the last week, for example, right, prior to this travel ban? It was probably already out of South Africa before it was even sequenced in KwaZulu-Natal in that laboratory. So my guess is that we'll see it here. Where it will show up, you know, first, and how we will know that, I don't know. But I think most people would say if it's already in Australia, it's already on 4 continents, why would the US be any different?
Not seeing any other questions, so I think that's where we will end things for this morning. Dr. Marazzo, thank you so much for your time this morning. And a reminder, we will send out a recording for this shortly after this. So everyone have a good Monday, and thank you so much.
Thanks, Adam. Thanks, everybody, for showing up. Stay safe.
And welcome back to CBS 42 Now. Phil Penarski here. We are once again just heard from UAB Dr. Jeannie Marazzo as she discussed the Omicron variant, the new variant out of South Africa. It was first reported in South Africa to the World Health Organization of COVID-19. If you look to the right of your screen, this is, of course, the COVID-19 dashboard courtesy of the Alabama Department of Public Health. As you can see, it looks a lot different since the last time we showed it to you here on CBS 42 Now. A lot less red going on. I do want to go over just a few of the things that Dr. Marazzo discussed in her press conference and Q&A session just a few moments ago regarding Omicron. And of course, we did hear from President Joe Biden earlier. He made his remarks after the U.S. announced that they would be banning travel from 8 different African countries due to the rise in cases from Omicron. Of course, we had it reported over on our website over the weekend that in South Africa specifically, which is the first country to report to the World Health Organization about Omicron, that they were experiencing about 200 new cases of COVID-19 a day, and they just had 3,200 cases on Saturday alone due to the recent abundance of Omicron in the COVID-19 sort of stratosphere there. Of course, the reason it's become such a variant of concern, according to the WHO, is because it has a high number of mutations, of around 30, they said, in the coronavirus's spike proteins, which could affect how easily it is spread around. Of course, the high transmission of the virus right now, and that is why Omicron is such a variant of concern. It has already popped up in 3 other continents. Of course, we mentioned it is spreading in South Africa. It has been linked to cases in Australia, Israel, and the Netherlands already. We heard from Dr. Marazzo that it's not a matter of if, but a matter of when we will find Omicron variants in the U.S. as well. But at this point, there is no recent rise in hospitalizations or deaths due to the virus. But again, it is all still very brand new. But one thing that the WHO is looking at is how easily it is transmitted to other people, but also are vaccines still effective against it? We heard Dr. Marazzo also making mention of the potential of a brand new vaccine having to be made in order to combat the Omicron variant of COVID-19. That is all speculation at this time. We will continue to be keeping you updated on the new variant of COVID-19. And of course, you can find President Biden's remarks on the virus as well. He and Dr. Marazzo both today requesting everybody get vaccinated for the virus in hopes that that will help stop the spread of the mutations and new variants popping up here in the United States. That is going to do it for us on this latest edition of CBS 42 Now. Again, you can find a complete replay of Dr. Marazzo's Q&A session over on our website, cbs42.com, in just a matter of moments. And you can also find all of the latest information regarding the coronavirus pandemic there as well, and also on our newscast. Of course, the next newscast coming up in about 17 minutes over on CBS 42. Once again, I'm Phil Penarski. We want to thank you all so much for tuning in to this latest edition of CBS 42 Now. We hope you have a great rest of your day.